If your blood sugar runs high, there are specific foods that bring it down faster than almost anything else available to you, and most people have never been told which ones actually work or why. So let's get straight to it, because that is exactly why you are here. The foods proven to lower blood sugar fastest are vinegar-based foods, specifically apple cider vinegar taken before a meal, leafy greens high in a compound called alpha lipoic acid, cinnamon in a specific preparation most people get wrong, and legumes eaten in a particular sequence within the meal. Four categories, each one working through a completely different mechanism inside your body, and each one backed by real clinical research showing measurable blood sugar reduction, not vague wellness claims. We are going to go through exactly how to use each one, the precise timing that makes the difference between a real effect and no effect at all, and the mistakes that quietly cancel out the benefit for most people who try these foods without knowing the details. But first, one quick piece of understanding that changes how you think about blood sugar control entirely, because most people are approaching this completely backward. Most people think about lowering blood sugar as something that happens after eating through diet adjustments over weeks, and long-term dietary pattern absolutely matters. But there is a separate and much faster mechanism that almost nobody discusses, and it is the reason these specific foods can produce a measurable difference within the same meal, not just over months. Certain compounds directly interfere with how quickly your digestive system breaks down and releases sugar from food into your bloodstream. This is not about changing your metabolism over time. It is about physically slowing the rate at which glucose enters your blood in the first place, which is a completely different and much faster acting mechanism. This is the discovery that explains why some foods produce blood sugar benefits within minutes to hours, while general dietary advice usually promises results only after weeks of consistent change. Both matter. But today, we are focused specifically on the fast-acting category because that is the title's promise and that is what you came here for. Let's start with vinegar, because the research here is some of the most consistent and well replicated in this entire category. Apple cider vinegar, taken in a specific way before a carbohydrate-containing meal, has been shown in multiple controlled studies to reduce the post-meal blood sugar spikes significantly. The mechanism is specific. Acetic acid, the primary active compound in vinegar, slows the activity of enzymes in your digestive tract responsible for breaking starches down into glucose. When those enzymes work more slowly, glucose is released into your bloodstream more gradually instead of in a rapid surge, which is exactly what produces the dangerous spike that damages blood vessels and tissue over time. Here's the timing detail that most people get wrong, and it is the single biggest reason vinegar fails to work for people who have tried it. They take it after the meal or with the meal, assuming the timing does not matter much. It matters enormously. Research measuring this effect specifically found that vinegar consumed 10 to 20 minutes before a meal produces a significantly stronger blood sugar reduction than vinegar consumed during or after the same meal. The enzyme slowing effect needs time to take hold in your digestive tract before the carbohydrates actually arrive. Drinking it at the same time as your food, or afterward, means the sugar is already being absorbed before the vinegar's mechanism has had a chance to engage. The correct method: 1 to 2 tablespoons of apple cider vinegar, diluted in a full glass of water, consumed 10 to 20 minutes before your meal. Undiluted vinegar taken directly is unnecessary and can irritate the esophagus and erode tooth enamel over time with repeated use. So dilution is not optional caution, it is the correct method. Studies measuring this specific protocol have shown reductions in post-meal blood sugar spikes in a meaningful, measurable range compared to the same meal eaten without the vinegar pretreatment. Now, the mistake that surprises people, because it involves a vinegar product specifically marketed around this exact use. Vinegar gummies and vinegar capsules, heavily marketed as a convenient alternative to liquid vinegar, frequently fail to produce the same effect, because the acetic acid concentration in many of these products is significantly diluted or buffered to make them palatable, and the dose delivered often falls well below what the research studies actually used. If you are going to use this approach, liquid apple cider vinegar, properly diluted, taken at the right time, is what the research actually supports. The convenience products have not consistently demonstrated the same effect. Now, leafy greens, and specifically the compound inside them that does the actual work, because not all leafy greens are equally effective here, and the reason comes down to one specific antioxidant compound. Alpha lipoic acid. This is a naturally occurring antioxidant found in meaningful concentrations in spinach, broccoli, and Brussels sprouts specifically, more than in most other leafy greens. What makes alpha lipoic acid relevant to blood sugar specifically, rather than just general antioxidant benefit, is its direct effect on glucose transport. Research has shown that alpha lipoic acid increases the activity and movement of GLUT4 transporters. These are the specific proteins in your muscle and fat cells responsible for pulling glucose out of your bloodstream and into the cell where it can actually be used for energy. More active glucose transporters means glucose clears out of your bloodstream faster after a meal, directly lowering the time your blood sugar spends elevated. Here's the discovery that surprises most people about this specific compound. Cooking method dramatically affects how much alpha lipoic acid remains available in these vegetables. Lightly steaming spinach, broccoli, or Brussels sprouts preserves significantly more alpha lipoic acid than boiling because the compound is water soluble and leaches out into boiling water, which then typically gets poured down the drain along with a meaningful portion of the very compound you are trying to consume. Steaming for 3 to 5 minutes, just until bright green and tender crisp, preserves substantially more of this compound than boiling for the same vegetable. If you are someone who has been boiling your vegetables for years, assuming the preparation method does not matter much for nutritional content, this is worth changing specifically for this purpose, even setting aside the general nutritional benefits of gentler cooking methods. Now, cinnamon, and this is where the preparation mistake is so common that it is likely affecting the majority of people who use cinnamon specifically hoping for a blood sugar benefit. Cinnamon contains a compound called cinnamaldehyde, along with specific polyphenols that research has shown can improve insulin sensitivity and slow gastric emptying, meaning food and the sugar within it leaves your stomach and enters your small intestine for absorption more gradually, which produces a flatter, slower blood sugar rise rather than a sharp spike. Here is the mistake. There are two main types of cinnamon sold in grocery stores, and most people have no idea they are using the less effective one. Cassia cinnamon, the cheaper, more common variety found in most standard grocery store spice aisles, contains significantly higher levels of a compound called coumarin, which in large amounts can affect liver function with regular daily use. Ceylon cinnamon, sometimes labeled true cinnamon, contains dramatically less coumarin and is the variety used in most of the controlled research showing meaningful blood sugar benefit with daily use. This matters for two reasons. First, safety, particularly with consistent daily use over months, where coumarin accumulation from cassia cinnamon becomes a more relevant consideration. Second, and more directly relevant to the blood sugar effect itself. Several studies comparing the two types specifically for their effect on fasting, blood sugar found more consistent, more reliable results with Ceylon cinnamon, while results with cassia cinnamon were considerably more inconsistent across different studies. Check your cinnamon jar right now if you have one in your kitchen. If it simply says cinnamon with no further specification, it is almost certainly cassia, because that is what the vast majority of commercial cinnamon sold in standard grocery stores actually is. Ceylon cinnamon needs to be specifically labeled and is usually found in the specialty spice section or ordered separately. The effective amount, based on the research protocols showing measurable benefit, is approximately half a teaspoon to 1 teaspoon of Ceylon cinnamon daily, which can be added to coffee, oatmeal, or yogurt, consumed consistently rather than as an occasional addition. Now, legumes, and this is the category where sequencing within the meal itself, not just what you eat, but the literal order in which you eat it, makes a measurable difference that surprises almost everyone who hears about it for the first time. Legumes, including lentils, chickpeas, and beans, are high in both fiber and resistant starch, both of which slow glucose absorption compared to refined carbohydrates. But the discovery here goes beyond simply including legumes in your diet. Research measuring blood sugar response based on food order within the same meal, not different foods, the exact same meal, just eaten in a different sequence, found that consuming protein and fiber-rich foods like legumes before consuming starchy or sugary components of the same meal produces a significantly flatter blood sugar curve than eating in the reverse order or eating everything mixed together without any particular sequence. Here is why this works. Fiber and protein consumed first begin forming a kind of physical and chemical environment in your stomach and upper digestive tract that slows the subsequent absorption of carbohydrates eaten afterward in the same sitting. Essentially, You are using the legumes or any fiber and protein rich food as a buffer that blunts the glucose absorption rate of whatever you eat next within the same meal. The practical application is specific and immediately usable at your very next meal. If you are having a meal that includes both a legume based dish and a starchy component, rice, bread, potatoes, eat the legumes first, ideally finishing most of that portion before beginning the starchier elements. This costs nothing, requires no new ingredients, and is purely a matter of sequence within food you may already be planning to eat anyway. Now, there's something about combining these four categories within the same meal that the research suggests produces an effect larger than any single one alone, and it involves a discovery about timing that most people never think to apply. The vinegar pretreatment and the food order sequencing work through two genuinely separate mechanisms, which means they stack rather than overlap. The vinegar slows enzymatic starch breakdown before food even arrives. The legume first sequencing slows absorption after food arrives. One acts at the front door, the other acts at the back door of the same process. Research combining both interventions in the same meal protocol has shown a larger reduction in post-meal blood sugar than either intervention produced individually in separate trials, not simply additive, but somewhat greater than the sum of the two effects measured alone, because each one is addressing a different stage of the same glucose absorption pathway rather than competing for the same mechanism. This means the most effective single meal you could realistically build using everything covered so far looks like this. Diluted apple cider vinegar, 15 minutes before sitting down. Steamed leafy greens and a legume-based component eaten first at the table. Any starchy component eaten last. Ceylon cinnamon added to whatever part of the meal can reasonably carry it. None of this requires special ingredients or significant cost. It requires sequence and timing, which are free. Now, a discovery about apple cider vinegar that almost nobody mentions, and it changes how long you should expect to wait before judging whether it is working for you specifically. The enzyme slowing effect of vinegar is consistent meal to meal once you take it correctly, but individual response varies considerably based on your starting insulin sensitivity. Research comparing vinegar's effect across people with normal blood sugar regulation versus people with insulin resistance found that the people with greater insulin resistance going in showed proportionally larger blood sugar reductions from the same vinegar protocol. This is not vinegar working better for some people randomly. It reflects how much room there is for the mechanism to make a measurable difference. If your blood sugar regulation is already reasonably efficient, the vinegar effect will be present but modest. If your blood sugar regulation is significantly impaired, the same protocol tends to produce a larger relative improvement, simply because there was more dysfunction available to correct. This matters for setting realistic expectations. If you try this for 1 week and the change feels subtle, that does not necessarily mean it is not working. It may mean your starting point already has more efficient regulation than someone for whom this protocol produces a dramatic difference. Either way, the mechanism is engaging. The magnitude of what you notice depends on where you started. Now, an overlooked warning that deserves direct attention because it involves a group of people for whom several of today's recommendations require modification rather than simple adoption. If you are on any blood sugar lowering medication, including metformin, sulfonylureas, or insulin, adding apple cider vinegar and the food sequencing approach simultaneously can produce a combined blood sugar lowering effect larger than either alone, which sounds beneficial but actually requires careful monitoring, because the combination can occasionally push blood sugar lower than intended, particularly for anyone on insulin or sulfonylureas, where excessive lowering carries real risk of hypoglycemia. This is not a reason to avoid these food strategies. It is a reason to introduce them gradually. Monitor your blood sugar more closely during the first 2 to 3 weeks of any change, and have a direct conversation with your physician before combining multiple new interventions at once if you are currently medicated for blood sugar management. Your medication dosage may eventually need adjustment if these dietary changes prove consistently effective for you, but that adjustment should happen under medical guidance, not by chance discovery of unexpectedly low readings. If you have any history of acid reflux or esophageal irritation, the vinegar protocol specifically requires caution. Even properly diluted, daily vinegar consumption can aggravate reflux symptoms in people prone to them. If you notice increased heartburn or throat irritation after starting this practice, This is a clear signal to discontinue the vinegar component specifically while continuing the other three strategies, which do not share this particular risk. If you have any kidney function concerns, consult your physician before significantly increasing legume intake, since legumes are relatively high in potassium and phosphorus, and depending on your specific kidney function, your physician may want to guide the appropriate amount rather than you adjusting intake based on general advice alone. Now, the timeline question, because this is genuinely a fast-acting category compared to most dietary advice, but fast is relative, and being specific about what fast actually means here matters. Within the same meal, properly timed vinegar and correct food sequencing produce a measurable difference in your post-meal blood sugar curve, visible immediately if you are tracking with a glucose monitor. This is the fastest tier of effect available through food, and it is genuinely same day. Within 1 to 2 weeks of consistent daily Ceylon cinnamon use, research protocols begin showing measurable improvement in fasting blood sugar, the reading taken first thing in the morning before eating anything, which reflects your body's overnight blood sugar regulation rather than your response to any single meal. This is a slightly slower tier because it depends on cumulative daily exposure rather than a single dose before a single meal. Within 4 to 6 weeks of consistently incorporating alpha lipoic acid-rich vegetables, particularly if prepared with steaming rather than boiling, measurable improvements in overall glucose transport efficiency become apparent in research tracking this specifically, reflecting the time needed for increased GLUT4 transporter activity to meaningfully shift your body's baseline glucose clearance capacity. This tells you something practically useful. If you are looking for an immediate same meal effect, vinegar timing and food sequencing are your fastest tools. If you are building toward improved baseline blood sugar over the following weeks, consistent cinnamon and properly prepared leafy greens are doing that slower, deeper work in the background, even on days when you are not specifically thinking about timing vinegar before a particular meal. Now, who benefits most from this specific combination of strategies, and an important distinction that determines how much these approaches alone can realistically accomplish for you? If you have blood sugar readings in the elevated but not yet diabetic range, sometimes called prediabetes, these four strategies, applied consistently, have genuine research support for producing meaningful improvement. And for some people in this category, consistent application of exactly what we have covered today has been associated with returning to normal range readings over a period of months, particularly when combined with the broader dietary pattern changes that exist outside today's specific fast-acting focus. If you have established type 2 diabetes already being managed with medication, these strategies remain genuinely valuable as a complement to your existing treatment, often allowing for better day-to-day control and potentially supporting conversations with your physician about whether medication adjustments are appropriate over time. But these strategies are not a replacement for prescribed treatment, and stopping or reducing medication based on dietary changes alone without physician guidance and confirmed blood testing carries real risk. If your blood sugar concerns relate to occasional post-meal spikes rather than a diagnosed condition, the kind of pattern some people notice through continuous glucose monitors even without a diabetes diagnosis. These four strategies are particularly well suited to your situation because they are specifically designed to blunt the post-meal spike mechanism, which is exactly the pattern you are trying to address. Now, a final practical detail that ties directly back to the title's promise of speed, because it addresses the most common reason people try one of these strategies once, do not notice a dramatic difference, and abandon the entire approach within days. A single application of any one of these strategies produces a real but modest effect. The larger, more noticeable effect comes from combining multiple strategies within the same meal consistently, which is why the combined protocol described earlier, vinegar before, greens and legumes first, starches last, cinnamon incorporated daily, produces results that people trying just one element in isolation often do not experience to the same degree. If you tried apple cider vinegar alone last year, noticed a mild effect, and stopped, that mild effect was real, but it was also only one piece of a combination that the research shows works considerably better as a complete approach than as any single isolated habit. Which of these four have you already tried on its own? And did you notice any difference at the time? Let me know in the comments, because the timing and combination details we covered today often explain why a strategy that seemed to do little in isolation actually has real measurable backing once it is used correctly and alongside the others.